Hi, Dr. Yan. Can you hear us?
Yes. Can you hear me?
Yes, yes, yes. Okay, wonderful. Well, everyone, thank you so much for taking the time to come and learn a little bit about Pandia Health. I'd like to go ahead and introduce myself. My name is Susanna Craig. I'm the Chief Operating Officer at Pandia Health. And today's goal really is to talk to you about the services that we bring forward, to let you know a little bit about Pandia Health, that we're women founded, that we offer expert care when it comes to birth control, perimenopause, and menopause, and that we're 100% doctor team here to support you every step of the way as Vivant providers. So why, should you partner with us? And we want to let you know that we are your trusted uh, Pandia pharmacy and medical group trusted partner that you could refer your patients. Or if you'd like to go ahead and write your script for birth control, you could definitely send it directly to Pandia Pharmacy so that your patients can experience free delivery, automatic refills, and discreet packaging. And as I stated earlier, our goal really is collaboration, not a competition. And to that end, I'd like to invite Dr. Sophia Yen, our CEO and co-founder at Pandia Health. I'm going to give you a brief description about what her background, as well as how we look at birth control consultation, some tips that you might help, and then how we can go ahead and collaborate in the future. Dr. Yen, I'll hand it over to you.
Great. I'm going to try to share my slides. Cool. Looking for the exact one. Okay, cool. So, yes, you are seeing my slides. And yes, I know it's not in presenter mode. The OCD in me likes to see what slide's coming up next so I can jump around. Please feel free to throw any questions you have in the comments. And Susanna, hopefully you can read those out to me. But as Susanna mentioned, we are the only women-founded, women-led, doctor-founded, doctor-led asynchronous telemedicine for expert birth control and perimenopause care. We're very proud that we've developed an algorithm for picking the best possible birth control pill for a woman, and I'll go over how that was developed and the results that we've come up with that. First of all, I know there's a lot of pediatric groups on here. You all know that teenage pregnancy is a huge issue in this country, in your county, everywhere in the United States. The good news is that there's been an 86% decline in teen pregnancy due to the use of contraception, and it's estimated that we could decrease it by 14% more if we could get the people that aren't using it to use it. And so you see here, this is the statistic for what birth control method did you use in teenagers if you had sex in the past 3 months. And they are using condoms 50% of the time, but they're only using pills or other hormonal, which are, the more effective methods, for a total of 50. So there's 50% more that we could get on more effective methods of birth control and prevent unplanned teen pregnancies. The current standard of care doesn't serve women well with respect to birth control. As you know, many of doctors' offices are backed up for 3 to 6 months for a new patient or for a patient to be evaluated for birth control or peri/menopause. There are 40 different birth control pills out there with only 2 to 3 commonly prescribed methods. And because of that, many of us were taught in medical school, here's a pill that I like, write that for everybody. And if we do that, one size doesn't fit all. Different people have different reactions to different birth control pills, and we'll go over that a little more on the later slide. But this results in 23%, almost 1 in 4 people using the birth control pill having unnecessary side effects. And then we calculate women spend 10 weeks of their lives going to the pharmacy, waiting for the medication, and coming back home. And I love hashtags, so hashtag better things to do, then go to the pharmacy and expose yourself to being infected at the pharmacy and coming back home. We can deliver the birth control. And I started this company in 2016 to make sure no one runs out of birth control in our watch. And that is Pandia pharmacy side. They can deliver the birth control. They don't charge anyone anything. And thanks to the Affordable Care Act, no copay, no deductible for any FDA approved birth control method. So no cost to the end user. Our company is evidence-based and 100% physicians, as Susanna mentioned, and our goal is to empower women to live better via personalized birth control and expert menopause care. As you saw the previous slide, we're asynchronous telemedicine, and we actually, I'll describe on the next slide why that's superior in some cases to in-person or audio or video synchronous telemedicine. We have a 100% physician team that's trained on what we're calling Dr. Yen's algorithm for picking the best birth control pill, and we're applying an AI ML model on top of that. And then lastly, we have our specialty pharmacy, which only does birth control and menopause. We can also do other drugs, but they know birth control pills and they know menopause meds very well, and they know what interactions to look out for. So the reason why asynchronous telemedicine is the future is that, anything that can be done outside your office should be done outside your office. But with respect to these confidential, private kind of stuff, how many sexual partners have you had? Does it hurt when you have sex? When was the last time you had sex? Are you sure you used a condom? Patients are actually more honest about these kinds of questions when it's asynchronous, because if there's a phone or a video or in person, they feel judgment perhaps, even though there may be no judgment there. But when you're just a questionnaire, tickety tick tick tick, and then tickety tick tick back, no judgment, no nothing, just words on a screen. The beauty of our asynchronous is patients can start their visit 24/7. And so they don't have to take off work if they have 2 different jobs, if it's the middle of the night, whatever, wherever they have internet. And that could be home, that could be work, that could be at the library, whatever. And then it allows you as providers to work at the top of your license. So you're seeing people for things that can only be done in the brick and mortar, and that gets paid better than counseling for birth control. So I was the original prescriber at Pandia Health, and so I wrote 3,000 birth control prescriptions over 2 years, more than most physicians. And coming from UCSF, Stanford, MIT, which is my background, I couldn't just sit there and write birth control pills and watch women suffer from the side effects. And realizing as a woman of color, everything in medicine is based on a 70-kilo white man. And certainly not for birth control, but this pill that we were taught at UCSF, Harvard, Stanford is great if you're a Caucasian female that wants to bleed every month. But if you're not Caucasian or you don't want to bleed every month, and I have a TEDx talk, #periods optional, that if you're bleeding every month, that is so 2020. Get with the times. We have drug and science to decrease your risk of ovarian, endometrial, colorectal cancer, anemia, while not bleeding every single month. So I came up with an algorithm how to pick the best birth control based on age, because I'm adolescent medicine board certified. We suggest 30 micrograms of estrogen until 30 years old to make sure that young person has enough estrogen to build their bones. Otherwise, if you give them the lowest amount of estrogen possible, then when they're 50 and they fall down the stairs, they're going to break their wrists. They're going to break their hip, God forbid. And so we want to make sure that doesn't happen. Race as a proxy for genetics. Right now we have self-reported race, so whatever the patient wants to self-report, but in the future, genetics obviously is going to be a better proxy. Health history, acne, PCOS, and then lastly, we're always making sure that stuff is accessible. So if they have insurance, we don't care what pill they're on. If they're cash, then we're like, well, there's 2 options. This one may be cheaper, but it may have more side effects. Your call. So with Dr. Yen's algorithm, we've used it on 41,000 patients to date. And what's amazing is we do a 10-week follow-up and we're like, you good? Breakthrough bleeding, side effects, headaches, munchies, anything bothering you want to change? 93% of our patients are like, let's go. I like it. Thank you. And then more importantly is the gold standard. The gold standard is somebody who's new to the birth control pill. We check in on them at a year. You still using it? And the national research studies have shown 33%. That's kind of sad. And then our competitors who do delivery, 55%. We've taken it from 33% adherence compliance at a year to 82% with picking the right pill and with our amazing customer service. 81 net promoter score. It means that your patients will promote you to other people, but if it's more useful for you, we have 4.9 out of 5 Google reviews. If you can look at our competitors, you would be sad for them. On the bottom, it shows you the difference between someone who knows how to pick the best birth control pill and someone who does not. So on the bottom, we've decreased headache incidence by 94%. We've decreased nausea incidence by 71%, and we've decreased breakthrough bleeding by 57%. Again, this is a proprietary algorithm that I came up with. We started with this, and now that we have data on 41,000 women, we're applying an AI ML model to see if it can beat Dr. Yen's algorithm. And I forgot to include the slide, but we do have an app where if you as a provider wanted to use our algorithm, we would charge, I think it's like $3 to $5 per use per person, and either you could pay it or the patient could pay it. But we realize we can't prescribe for everyone, but that's an option to think about. The rest of my talk is some basic birth control background info for you all, because I thought it'd be useful for you all to know. But I also have at the end some peri/menopause if anybody thinks that's useful, but Susanna, stop me at any time. So this slide always blows my mind. This is from the CDC, and I don't know if it's still up on the website given the current political background, but anyway, what blows my mind is that the implant beats vasectomy. How does something that you stick in your arm that, you know, elutes medication throughout the whole body beat the gold standard? And then the IUD with hormone beats tubal ligation. And as you all may know, tubal ligation is no small feat. It is take out an inch on each side, burn, burn. And how anyone gets pregnant after that is like a testimonial to the crazy fertility of some people. But the IUD with hormone beats tubal ligation. And you can see on the chart that the implant beats male vasectomy. Male vasectomy has 3 times the risk of the implant. And then with respect to female sterilization, the IUD with hormone is half as likely to get pregnant than tubal ligation, which is like, whoa. And then the copper IUD, a lot of young people are very anti-hormone, and they've been pushed to consider these other anti-hormone situations, but no, and please do cancel, and I'm sure you do, but it shows up all over TikTok and social media. The 2 greatest side effects on the copper IUD is more blood, more cramps, more pain. And each person's different. So certainly if your patient's the one who's like, oh, is that blood running down my leg? And they don't notice, that is a great candidate for the copper IUD. But if you're like me and you feel every drop going through your body, crampy, 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 maybe not a good candidate for the copper IUD. Then comes the shot, which, as you know, is every 12 weeks. And the 2 major side effects there are breakthrough bleeding and munchies. And a concern is bone density, all of which goes back to normal if you come off of it for 5 years. The weight gain may be permanent unless you work to get that off. Then comes the ring, the patch, the pill, which we supply. And here in the graph, it has them all as the same efficacy. But as you know, the ring has 12 times a year you can mess up. The patch has 52 times a year you can mess up. And the pill has 365 days that you can mess up. But there is, plus or minus 1 or 2 day forgiveness on most standard birth control pills. And then condoms, we always advise condoms plus one of these hormonal or permanent or copper IUD methods to prevent sexually transmitted infections, and then withdrawal and fertility awareness method. Next, I want to go over that the latest is not the greatest, because I always thought whatever's the latest must be the best possible thing. But I realize now that the latest may just be something somebody came up with, and it may not be the greatest. Or in the part of the over-the-counter pill, it was the only one that was off patent that the company could buy and then try to take it over the counter. So Phexxi is what I'm referring to. Some of you may have been harassed about a year ago by a whole bunch of patients. Ask your doctor about Phexxi. I hate it when drug companies tell them to do that, and they didn't tell us anything about Phexxi, so I gotta go learn about Phexxi. So Phexxi works by keeping the pH in the vagina acidic, which is the normal pH, and know that sperm is actually basic. And the way it works, it's not a spermicide, but it works the same way. It affects the sperm and reduces sperm motility. The big problem is we believe in practicing on the academia, but also at Pandia Health, cost-effective medicine. It's $353 for 12 doses. And you have to use a dose every single time you have sex. And I remember back in the day when I was 15, when I was 20, it's like 3 times a night when you did it. So that's like $100 every time you have sex. That is crazy expensive. And its efficacy is 15% will get pregnant, but spermicide is 21%, which I feel is similar. Spermicide's 10 to 15 bucks. This is 353. They purposely maybe made it prescription because under the Affordable Care Act, no copay, no deductible. But as a taxpayer, as a fellow insurance user, I don't want you blowing 353 bucks when you could be blowing 5 to 10 bucks, right? Also, it's not for someone with a history of urinary tract infections. As you know, we tell everybody to pee after sex, but if you stick something there, then there's going to be more goop to block up the urinary tract infection and increase your risk of urinary tract infection. And then more limitations. You have to put it in at least an hour before. And again, you got to reapply every time you have sex. Do not use it with a vaginal ring because people sometimes add 2 things together, yay, condoms plus something, but the acid will eat the vaginal ring. So that will not be a good thing. As I alluded to, the over-the-counter birth control, it's Norgestrel. It's a progesterone-only pill. It's called the O pill. And as you may or may not know, progesterone-only pills are great for breastfeeding women, women who are 35 and smokers, women who wear estrogen are contraindicated. But again, we're talking pediatrics. The key is, as you also know, progesterone-only pills have a 3-hour window. And if you had sex in the past 5 days and you were late because you were watching Oppenheimer or some crazy long marathon movie or on Netflix or something, and you had sex in the past 5 days, then you are at risk of pregnancy on this medication. And you need to abstain for the next 2 days as it gets back up to the right level. And if you're trying to prevent pregnancy, you need to take some emergency contraception as soon as you possibly remember it. So it's just, to me, who is most likely to need an over-the-counter pill? Somebody who's busy, doesn't have time, whose life is chaotic, who's most likely to be late by 3 hours? The same person. But it is the best possible thing over the counter. But if you have access to a birth control company like ours, which is open 24/7 and is only if you weren't with Vivant. Vivant is providing it for free. We normally charge $35 once a year to use our expert physicians. Note that this medication is safe. It was FDA approved in 1973, but it was taken off market in 2005, which is before many of your patients, adolescents, were even born. And the reason is not because it was horrible, but because everything else was better. So anything we can prescribe, anything you can prescribe beats this. And then just know that, if somebody goes on the birth control pill standard, estrogen, progesterone for 5 years, they decrease their risk of ovarian cancer by 50%. This being a progesterone-only method, we think it probably does not have that ovarian cancer projection. And then upcoming, because you want to know the latest and greatest, there is a 20 microgram ethinyl estradiol pill with levonorgestrel coming soon. But as I mentioned, we want anybody under 30 to be on 30 micrograms to protect their bones. And so this is not going to be good for anybody under 30. But if you have patients that are 30 and above that you're treating, then go right ahead. And then hashtag get the good stuff. So there is a new pill that's a progesterone-only pill. This is the exception to all the progesterone-only pills. It was purposely, or maybe the reason why it exists, is it has a 24-hour window of forgiveness. It also has the progesterone that is very good for PCOS, acne, etc. The negative of it is a spironolactone-like diuretic effect. And there's a risk for hyperkalemia if there's any kidney problems. But again, the beauty of adolescents, they usually don't have any problems with their kidneys. And then hopefully our young adolescents are not smokers, nor do they have hypertension. The main negative on this is it's $194 per pack, which a normal progesterone-only pill is $17. I believe the O pill is like $20 or $30 because we are a capitalistic society that charges whatever the society will pay. And then Yasmin generic would be the combined estrogen progesterone pill that's similar, $16, or Susanna can correct me on that one. It might be a little more.
So Dr. Yen, for the blend, it's covered with Medi-Cal. both
Yes.
Medi-Cal patients, and then there's a savings card for those that want to pay out of pocket that takes
Right.
it to like $15, $25.
Yeah. And then sometimes there's a prior auth, which, most of us hate doing. And then again, as a taxpayer, you can pay for an entire year's worth of birth control. So don't use this unless you need to use it. But if you need to use it, then totally use it.
Like
But
if they're having like migraine headaches and they want to skip their periods, right?
yes. So if you have migraine with aura and you want
Mm-hmm.
to skip your periods, but if you have straight up migraines, then it's perfectly fine to use an estrogen containing
Mm-hmm.
birth control pill. And that's what we've trained our physicians on. If your providers haven't been trained on that, we know everything about birth control because that's all we do all day long. Best practices, if you are still prescribing triphasic birth control pills, it is not recommended. Nobody from an academic center trained should have ever been taught that. And if you go to the WHO, they do not recommend any triphasic pill. They were originally formulated to mimic the normal periods, but as I'll go over in my hashtag periods optional, life is better on stable hormones rather than up and down, up and down, up and down every single month. So no triphasic. Anything with 3 letters TRI in its name is a triphasic. So instead of ortho tricycline, you want orthocycline. Instead of esturia, triesteria, you want esturia. You get the idea. We talked about estrogen 30 micrograms. And then my Dr. Yun's algorithm, I realized, that it's our algorithm best serves people of Asian, Black, and Latino descent, and everyone in general to have personalized picking of the birth control pill. Top 3 reasons for missing a pill. Number 1, forgot. And as you all know, we all have cell phones, so you can set an alarm. And if it goes off, then you should take your pill. I have a friend who makes a birth control pill holder. And if you don't pop out the pill by a certain time of day, you can set it to call or text you until you pop out that pill. Away from home, extra travel pack. So never be afraid to give a patient an extra pack. Know that it only costs, $13, $20 for that extra pack, and it's worth it for peace of mind. I always have one in my backpack, in my suitcase, my purse. I just don't want to run out and need to bleed when I don't want to bleed, but also the risk of pregnancy. No new pack. Know that in the state of California, we are allowed to write a year supply at a time, and insurance is required to cover that. Whether or not insurance actually does, our pharmacy side can tell you it doesn't most of the time. So if any of you are in advocacy and you all are in Sacramento, maybe you could get somebody to fine all of those insurance companies for not following the law. But please write a year supply, 13 packs if they're not skipping, 17 packs if they are skipping. And then the no new pack was the whole reason I created this company, with the goal of no one runs out of birth control on our watch. What's awesome is that our pharmacy can deliver to 49 states plus DC, and that we can prescribe in all of these states that we listed, which is good for any college students that you might have, or anybody that's going on vacation. They can always just call us, text us, and our doctor will be like, oh, you're in Vegas and you forgot your pills? Here you go. We don't have Hawaii, but in these states, we've got it covered. So if they're visiting any of the Disneys, or if they're going to South by Southwest, we got you covered. The reason I'm avoiding the screen is the sun is in my face. There we go, better. Okay. Emergency contraception, really important. I gave this talk to a bunch of Stanford doctors, and only 1 out of 60 got this right. So here's a quiz for you all to take. Envision all the emergency contraceptive methods from most effective to least effective, going from left to right. Know that there are 4 different types. And here we go, as my children go, dun, 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 back when they were young. On the left is the copper IUD. Generally not a fan of it because more blood, more cramps. But in case of emergency contraception, if it were my daughter, my friend, my acquaintance, my patient that was sexually assaulted, I would go run to the ER and throw down a copper IUD, because its efficaciousness of preventing unplanned pregnancy within 5 days of contraceptive failure, or God forbid, sexual assault, 99.999999999 effective. So it's pretty amazing. Know that since, I believe, 2021, so 4 years, almost 5 years now, New England Journal published a paper that you can actually use the hormonal IUD. The failure rate there is like 3 out of 313. So pretty amazing. The one that most physicians didn't know about, but I hope most people now know, is prescription emergency contraception. And the reason it's important is because you're a provider, you can write prescriptions. That's kind of your job. So you should know about this. They were all like, well, we don't need to know about that. There's this over-the-counter contraception. And yes, Plan B and its generics are over-the-counter, but it is the third out of fourth most effective. You want to give the most effective or the second most effective, not the third most effective. There is a price difference. Generally, I'd say Ella's like 25, 30 bucks. And this one you could get maybe for 10 on Amazon or something like that. And then
Medi-Cal covers it fully.
Yes, Medi-Cal covers both of these. And thanks to the Affordable Care Act, anything you write is a lot easier to get covered than something that you don't write for. But you can write for all of these. Lastly, is if you're stuck on a desert island, all you got is a bunch of pills. You can take generally 4 now, 4 in 12 hours, but you got to check that it has either norgestrel or levonorgestrel, and you can Google the dosages on that. Just want to show you here, the higher the column, the greater the percentage of pregnancy. And although one could say in the first 24 hours, red is the pregnancy rate on olapristal acetate or Ella. This blue-gray is what happens on Plan B and its generics. One could say that's 2.5 times more effective, this one than that one. Or like I like to say, if you're pregnant, you're 100% pregnant. So if it were me, my daughter, my friend, I would get this. And at Pandia Health, every patient that we give birth control to, we're like, hey, you want some emergency contraception with that? We recommend Ella, but if you really like Plan B, sure, you can go for Plan B. However, know that Plan B doesn't work so well if your BMI is 26 or greater, and my BMI is 25. If I eat some extra dessert, 26. And so, again, don't want to be pregnant, and it would suck if you take it and you think you're preventing pregnancy, but you're not. So this is really important for college students. They're giving it out on college campuses. They're putting it in vending machines, which is great, but they really should have a sticker that says, check your BMI. And if your BMI is 26 or greater, doesn't work so well. If your BMI is 30 or greater, does not work at all. So if they have a BMI of 30 or greater, and as you know, 60% of the adult population is overweight, obese, then they may need Ella or the IUD. And if the BMI is 35 or greater, that's the obese side, then only IUDs work. And then this is the one slide where I will try to go to full screen because I'm so proud that I actually got it to do this. Think of emergency contraception as a fire extinguisher analogy. You want it ready to go. And so I tell my patients, if the condom pops at 3 a.m., I want that medicine in the person with the uterus's mouth by 3:10. I don't want any cuddling, huddling, waiting till the morning after, because if the egg and sperm meet up, it's too late. And so you want the emergency contraception to put out the fire, not, oh my gosh, is it available at the pharmacy? Is it covered by insurance? Can I get to the pharmacy? Do I have the money? Is it covered? You know, all that. Deal with that before your emergency. So get it ahead of time. And I also write in the prescription, in the line to the pharmacy, please give the patient the one with the farthest expiration date because it can last for up to 2 years. And if you had to pay cash for it, it's 35 bucks. So if you 1 in 5 or 10 friends, you split this price, totally worth it. Because there are a lot of conservative people out there, given the current administration and just for general life, we want to think of birth control as more than just birth control, that it is actually hormone therapy to level the playing ground. And so I have a TEDx talk on periods optional. I'm going to go through the benefits because you as pediatricians see them when they get their periods. You as pediatricians see them when they have painful, heavy periods, and they should hashtag stop sucking it up. Just because it ran in your family doesn't mean that you have to suffer through it. And the example I give to patients to help them understand is that everyone in my family runs blind, but we don't go like, oh, well, we want to stay natural. We're not going to wear glasses. We're not going to get LASIX. Everyone in my family runs with horrible allergies. And again, we don't go, oh, I'm not going to take my inhaler. I'm just going to suffocate and die. I don't take my allergy meds. I'm going to walk around with the stuffed nose. We use the science to make our lives better. So if they are missing school or if they're missing work or if they have anemia or they're having iron deficiency, please offer them the ability to make their periods lighter at the very least, but also you can make periods optional. So if you don't know, the number one cause of lost school and work for anybody with a uterus under the age of 25 is heavy or painful periods. That 10 to 45% of young women miss school. When I was at Children's Oakland, people would miss 2 days of school a month or 5 days of school a month. And you're like, 2 days? Oh, that's nothing. They only have 20 days of school a month. That's 10% of their education. And as a tiger Asian mom, 10%, you're already at B+ at best if you hit 100% of everything you go to. So that's unacceptable. You have to be able to get an A. And then academic competitiveness, I've already gone over. Anecdotal, teenagers already, their life sucks, zits, and worrying about this and that, but worrying about being hit by random blood 1 week out of 4, cramps. And then for sports performance, so there was a Chinese Olympic swimmer, and it was the first time ever that an Olympic swimmer, it was like 4 to 8 years ago, mentioned her period. And we know all the previous Olympic people have had periods, but she came out of the pool and she's like, ooh, I think I missed a millisecond, and she missed gold because she had a cramp. And I was like, who the heck is your doctor? Because if I were your doctor, no way would you be bleeding at the Olympics. I would have pre-bled you the week before, or I would have made sure we had perfected #periods optional before you went into the Olympics and that entire team. And I will actually be talking to UC Berkeley's basketball team on Saturday about how they're going to get the edge over all the other basketball teams. Better with stable hormones, acne, arthritis, depression, diabetes, seizures, anything related to periods. If we get rid of the period, then you get rid of the problems. So if you have painful periods, heavy periods, PMS, PMDD, we get rid of the M, no longer PMS, no longer PMDD. And as you all know from medical school, or hopefully your healthcare education, we love to ask medical students, what's the #1 cause of anemia in a menstruating woman? The answer is in the question, menstruation. And certainly if they have a bleeding disorder, as you know, their first period manifests as what we call murder scene period all over the bed. And we would not want somebody to have to get transfusions because they could have been treated with the birth control pill. Know that the fewer times someone pops an egg, the one way to decrease ovarian cancer is by going on the birth control pill, patch, or ring for 5 years, and that will decrease your risk of ovarian cancer by 50%. And the longer you're on it, the better the protection. And then it also decreases endometrial as well as colorectal cancer. I bring up colorectal cancer because we need to talk to our patients that if you have periods, 30% of women have constipation or diarrhea. And the way I kind of like tell stories to patients, you have your uterus, you have your colon around it, and every month the uterus is like up and down, up and down. And the colon's like, oh, I'm sad for you, as you see in this picture. And it either runs faster, which we know is diarrhea, or runs slower, which is constipation. Anytime you mess with the colon, you're going to increase your risk of colorectal cancer. So it's an explanation, but it's also a normalization and an acknowledgement that 30% of people with uteruses bleeding every month will have something messed up with their gut. So it's just nice to let people know it's not all in their head, that they're not alone, and that there's something we can do about it. I thought I came up with this idea when I was trying to get pregnant with my first child in 2006, but Dr. Coutinho beat me to it, as is Dr. Shelley Segal, who was a founder of Norplant. I had the pleasure to serve with him on the Center for Reproductive Rights board, but they have an entire book with all the research studies and all the citations. Then people will say, but wait, it's not normal not to bleed every single month. But actually, normal human biology is fewer menses. Dr. Beverly Strassman, who's a medical anthropologist, studies the Dogon tribe in Mali, Africa, and she studied women that were banished to the menstruation hut for 736 nights. That's a different talk on a different day, but suffice it to say, on the left is the Dogon tribe, what you would call natural. On the right is the United States. And on the left, they have, most importantly, in yellow, 100 periods in their lives. We have 350 to 400 periods in our lives. That's enough bleeding for 2 or 3 other people. I don't like that. I don't like blood. How does this happen? They have 8 or 9 children. How many periods do you have when you're pregnant? 0. We have 2 children. They breastfeed for 12 months, 15 months. We breastfeed for 0, 3, or 6 months. Multiply 12 times 8 or 9 children. Breastfeeding every 2 to 3 hours. How many periods do you have when you're breastfeeding every 2 to 3 hours? 0. So the natural state of a female woman, per my UCSF OB-GYN professor, is pregnant or breastfeeding. How many periods do you have when you're pregnant or breastfeeding? 0. And over here, we're incessantly menstruation. As I mentioned, every time you build that lining, it could turn into cancer. Every time you pop out an egg, we don't know if it's popping, the healing, we feel it has something to do with tubes, ovarian cancer. And then we talked about colorectal cancer. And if that doesn't convince young people or you, then environmental. This was just what was under my sink. As a woman, we have this in our backpack, we have it in the purse, we have a sink, every bathroom we go to, we would like this, we would like free menstrual products. And that's a side note, but if you don't provide free menstrual product, then you're sexist and possibly ageist as well. But we should provide it. It is a matter of dignity. But we use a lot of these. And so you'll use 10,000 to 13,000 of these if you don't cut down how often you bleed. So it's a difficult concept to convey. Without hormones, if they don't have a period, then yes, they need to see a doctor and we need to work that up. We need to look for thyroid. We need to look for anorexia, relative energy deficiency of sport, cancer, pregnancy. And then, but once we know that they have regular normal periods, you can hashtag make periods optional. And if you want a repeat of that talk or you want to share it with your patients, if you go to pandiahealth.com/periods optional, it's at the bottom, my TEDx talk. So that's my kind of birth control talk. If anyone wants extra menopause, I'm happy to go there too.
I think we're good with the time. We are going to have another webinar for the Vivant providers. But Dr. Yan, you'd mentioned before, first of all, thank you for the presentation. You'd mentioned before that there's some criteria that we want to, that doctors should take into consideration before writing a script. Like at least the patient should have had her period for at least a year or 2 years, or is that what we're...
So for writing a prescription for birth control, the only indication is that you're having sex, and we want to prevent unplanned pregnancy. But in terms of making hashtag periods optional, I generally don't recommend it just for if you come from short people. So my joke is my daughters come from short people, and I was like, you guys go ahead and wait until you've hit your full adult height, and then you can use it unless you're missing school or work or it's adversely affecting your life. But I have another friend whose daughter was 6 foot, and she's like, I think she's okay. And I was like, yeah, okay, if she's fine. Because as you know, everybody's growing for 2 years after their menarche, their first period. And so I would wait at least 2 years before I would consider hashtag periods optional if they care about their height. If they don't care about their height, then go right ahead. And if it's bad enough they're missing school, then I think losing an inch or two of final height is fine.
Mm-hmm. Okay, thank you. And then I guess the other thing too is like most young adults are introduced to birth control usually because of their acne. So yes. Is there anything in particular that we'd like to share with the Vivant providers about that?
I would say that, generally, if you have acne, we like a drospirenone-based birth control pill. But the counter is it's really important to know that they should drink 8 glasses of water a day. If they can't drink 8 glasses of water a day, do not prescribe them drospirenone or warn them they may get headaches. And the example I give is in China, birth control pills are over the counter. So a girlfriend asks another girlfriend, hey, what pill are you on? And that's not the best way to pick the pill because each person's different. You should ask what worked for your mom, your auntie, your sister, your cousin. That is your best bet, not what is your friend, unless you're genetically related. And then she's like, I have these headaches. And I was like, what pill are you on? And she's like, drospirenone. And then I was like, how many glasses of water you drink? Not very much, because the bathrooms at school are scary, stinky. The teachers penalize you if you go to the bathroom, which is a different policy thing we need to work on because people should be able to pee when they need to pee. And we should encourage them to drink water so they don't get headaches and other bad things. But if they can't drink 8 glasses of water, I would not recommend drospirenone. But, it's all about informed decision making. So you tell them if you get a headache, then it may be because you picked this pill, but it is really good for acne.
Wonderful. All right. Well, thank you, everyone, so much for your time. We want to go ahead and share with you that we're available. And this video will be available on the Vivant website as well, and by invitation only on YouTube. Know that we're more than happy to help your practice by helping your patients obtain best care when it comes to birth control. And if required, we could also send information about what script is written for the patient. Otherwise, if you'd like to go ahead and write that script directly for birth control for your patient, we're more than happy to deliver the medication for the patient directly. So on the chat, you'll see that I put the URLs for both periods optional, also the Vivant landing page, and other information that you'll feel that would be very useful to you all. But thank you so much for your time. Thank you, Dr. Yen. I know that you're at the airport, ready to go. Thanks again, and we'll be talking soon. Have a good one. Bye. Bye, everyone.